Today on Jeopardy, we have Dr. Kelsey from the University of Buffalo, a medical doctor. Our second contestant is Allie, a sophomore P2 here at Ohio Northern University. Our third contestant is Kevin. Good evening and welcome to tonight's edition of Jeopardy! Tonight we will be featuring Kaposi's sarcoma, which is a rare but very serious disease. I'm your host, Alex Trebek. Etiology for 200. The virus contains this type of genetic information.
What is double-stranded DNA?
Yeah! Okay, etiology for 400. The virus contains this type of capsid.
What is complex capsid? Icosahedral!
Correct!
Oh!
Alright, the final etiology question for 500. HHV8 is classified under this type of virus. Dr. Kelsey.
What is retiноvirus?
Correct. Alright, transmission and clinical features for 100. This is the way that Kaposi's sarcoma is transmitted. Dr. Kelsey.
It's transmitted through sexual contact through the mouth or the genital areas.
True, good job. Alright, transmission and clinical features for 200. Kaposi's sarcoma is frequently found in this type of population. Kevin.
Alright. What is homosexual men transmitted through anal sexual intercourse?
Correct.
Yeah! Woo!
Pathogenesis for 100. This is how the virus enters the body. Dr. Kelsey.
It enters the body via sexual contact with an infected individual.
That's correct. Alright, pathogenesis for 200. This is how the virus attaches. Dr. Kelsey.
What is attached to the epithelial tissues of the genital mucosa?
Good job, that is correct as well. Alright, pathogenesis for 300. This is how the virus overcomes its host defenses. Kevin.
What is an intracellular pathogen that hides in the lymphocytes and remains latent?
That is correct.
Oh, get on my level, ladies.
Pathogenesis for 400. This is how the virus damages the body. Allie.
Yay! Okay. Well, once the virus has entered the host cell, viral G protein coupled receptor, VGPCR, activates the production of AKT, tumor necrosis factor, and other factors that lead to the formation of lesion and tumors. HHV latently affects most tumor cells, so they are resistant to antiviral drugs. Or what is that answer?
That is correct.
Yay!
You go, girl.
I go!
At this point in our show, I regret to inform you that Kevin has contracted a very serious case of Kaposi's sarcoma, and he will be in the hospital for a very, very long time. He is now replaced by his brother, Carl. Pathogenesis for 500. Once inside the body, this is how the virus exits. Kevin.
The virus exits during sexual intercourse.
Correct.
Yes.
Alright, transmission and clinical features for 400. A physician would notice this in someone that is infected. Kelsey.
What is bluish red or purple lesions under the skin that cause pain?
Alright, diagnosis for 500. This is how a dentist could actually help discover Kaposi's sarcoma. Kelsey.
Lesions in the mouth can be discovered during a regular dental checkup.
Correct. Alright, diagnosis for 100. This is a common way to diagnose a person with Kaposi's sarcoma. Kelsey.
What is physical examination of the skin and lymph nodes by looking for lumps?
Correct. Okay, treatment and prevention 100. This is the best way to prevent Kaposi's sarcoma. Carl.
What is avoiding unprotected sex, abstinence, avoiding sharing of needles, safe blood transfusions, and testing for HIV?
Those are all correct answers. Good job, Carl. Alright, treatment and prevention for 200. For areas on the body with single lesions, this kind of therapy is used to treat Kaposi's sarcoma. Kelsey.
For single lesions, treatment may include radiation therapy or surgery.
Correct. Good answer. Alright, treatment and prevention for 300. For lesions that are found all over the body, this type of therapy is used to treat Kaposi's sarcoma. Allie.
Woo! Okay, what is treatment is radiation and chemotherapy.
That is your first correct answer. Good job. Final Jeopardy! This Hungarian dermatologist originally discovered this disease while practicing at the University of Vienna in 1872. Carl, what is your answer? Moritz Kaposi, that is correct, and you wagered $100. Allie, what's your answer?
I said Bill Clinton for $1,537.02.
That is incorrect, and you didn't have that much money anyways, but good try. What's your answer, Kelsey? Moritz Kaposi, that is correct. Results for the day. Carl/Kevin with 52,000, Allie with a total of 0, and Kelsey with 53,000. Thank you for joining us this evening. Have a great night.